Hello, I'm Dr. Yatin Sethi. I'm a senior ENT consultant at Venkateshwar Hospital, Dwarka. During these days, we are hearing and reading a lot about mucormycosis. I'm getting a lot of patients of mucormycosis, and many patients of mine are very anxious about this problem. There have been a lot of things in the media, especially by the government, who wants to make the people aware of this problem. So, in this video, I'll discuss about mucormycosis and should you be worried about it? What is mucormycosis, commonly known as the black fungus? It has been there around us since years. It is available in the soil, in the environment, in the humid places, in the water bodies. But it doesn't affect any normal, healthy human being. So why this fungus is becoming more important to us now, especially in this COVID time? That I will answer you in this video. This fungus commonly affects the lungs, the nose and the sinuses, the eye, and if not treated, even the nervous system, the brain. So who all people are at risk? Not everybody is at risk. There are 6 categories of people who are at risk. Those patients who are suffering from diabetes, especially the uncontrolled diabetes. The patients who are taking steroids, especially those patients who are taking steroids for a longer duration of time and taking the steroids without the prescription without the advice of the doctor. Patients who have taken immunosuppressive injections like tocilizumab. Patients who are undergoing chemotherapy for some cancers, those kidney patients who are under dialysis, and post-transplant patients who are also on immunosuppressive drugs. Patients who are on ventilator for a longer time, or those who are on oxygen support for a longer time during this COVID recovery. Patients, especially those patients who have low immunity. So these are the category of the patients who should be aware of this problem and who are at risk. Normally, the healthy patient should not have any worry about this mucormycosis. So what are the symptoms that the patients they present to us with suffering from this mucormycosis? The patient generally can have a headache or a one-sided facial pain. The pain will be very severe and there will be no reason to the pain. There will be nose blockage, sinusitis, and can sometimes have a blood-stained nasal discharge. There can be some loosening of the teeth or blackish discoloration of the palate, and there will be some swelling around the eye. So any patient who have any of these symptoms, they should go to a physician and discuss about it, because in this problem, early detection, early diagnosis and early treatment is the key to the management, and it can save many lives. So take my word, go and consult your physician if you have any of these symptoms. And remember one thing, this problem of mucormycosis is not contagious. It is not like if you have one patient in the house, the other can also catch it. So don't be afraid of this problem. It is not contagious. So how can you prevent this problem? So they are very simple. There are 7 methods by which you can simply prevent this mucormycosis. First is treatment of diabetes. If you are having a COVID infection and you are a diabetic patient, please keep your sugars in control. Go to the doctor. If the sugars are not in control, take their advice. You might need to step up your medicines. So keep your blood sugars under check. Steroids. Don't take the steroids without the treatment of the doctor. The problem in India is the steroids are freely available at the chemist shop, and every other person is just taking the steroids without the recommendation of the doctor. So how much steroids to be taken and for what long duration of the steroid, for how long the steroids needs to be taken, please take the advice of the doctor. What we have seen is कि patients steroids तो शुरू कर देते हैं अपने आप, but वो steroids कब बंद करने हैं, कब ख़त्म करने हैं, वो उनको नहीं पता. So as a result, they take steroids for a longer duration of time. So keep this thing in mind. Oxygen tubings. Those patients who are dependent on oxygen support, please change their tubings at a frequent interval of time. Like every few days, these tubings should be cleaned and should be changed. Nasal douching. Keep your nose clean. There are sterile saline sprays available in the market. One should keep the nose clean by using these saline sprays. Mask. Again, we are coming to the basics. Mask is very important, especially for those patients who are admitted in the hospital for COVID. Please wear the mask while still you are in the hospital. Consult your doctor. Don't start any treatment without the consultation of your doctor. Whatever may be the treatment, please consult the doctor and then only start the treatment. And last and foremost, improve your immunity. Increase your immunity. Eat healthy so that your immunity can bounce back and can fight this fungus. If you have good immunity, this fungus will not trouble you. So there are 3 take-home messages. First, healthy patients should not worry. Don't be anxious about this problem. If you are healthy and you have no other medical issues, you should not be worried about it. Second, diabetic patients, please keep your blood sugars in control. If your sugars in control, you will not catch this infection, this fungus. And third and most important, steroids. Use steroids judiciously. Don't use steroids without the prescription of the doctor. So if you simply keep these 3 things in mind, you will be safe from this fungus and this fungus will not trouble you. Goodbye.